Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte is set to decide on the proposal to ship Metro Manila and the rest of the country to a modified general community quarantine. But experts warn against the move amid rising number of cases in the region and the threat of the new variant first detected in the UK. Also, following the delays on the arrival of COVID-19 vaccines, senators say the Philippines is lagging behind its vaccination program. Health Secretary Francisco Duque joins us live. Authorities are set to decide if the country should be placed under a less restrictive, modified general community quarantine. The move comes even as Metro Manila sees an upward trend in daily COVID cases. Vice President Leni Robredo questions the MGCQ proposal, saying we should focus on controlling the virus transmission and securing the vaccine. Senator Bongo also echoes Robredo's sentiments. He says Filipinos should first be vaccinated before relaxing quarantine restrictions. Let's go straight to the source of the story. We have Health Secretary Francisco Duque III. Secretary Duque, good to have you again on the show. Welcome to the source.
Yes, thank you, Pinky, and good day in behalf of the Department of Health and the Interagency Task Force on Emerging Infectious Diseases. It's nice to be back, Pinky.
Cabinet meeting that will happen tonight, of course, with the President. Secretary Duque, do you think that the issue on shifting to MGCQ will be the focus on tonight's meeting?
Definitely, Pinky. That will be the main agenda item for our cabinet meeting tonight with the President.
Are all secretaries supportive of this, or is anyone opposed to it?
Well, the process in the IATF is quite democratic, and any decision or resolutions passed go through consensus building. So pretty much it has the support of the IATF.
Yeah, but would you know if any secretary is not comfortable with shifting to MGCQ?
Well, that's a very difficult question to ask, but I would much rather talk about the collective decision rather than individual positions on the matter.
With that answer, it seems that there are, I'm assuming, some secretaries are opposed to it. So tell us your personal take on the issue, Secretary. If you are obviously supportive of this, are we really ready?
Well, you see, Pinky, in sometime in October, we had the IATF and the cabinet, and the president supported eventually the reduction of the social distancing or physical distancing in the transport sector. Okay, that was in October. The health experts had predicted or projected there will be an increase of about 600 plus cases daily if we reduce the physical distancing in the transport sector. Luckily, there is no evidence to show that that increase did happen. No? Then also, I think sometime in October, the age restriction, the going out age, no, was unanimously decided by the cabinet to reduce it to 15 years of age. And then, of course, although that was the decision, the LGUs maintained the going out age at 18 to 65 years of age, no? And then also the projections on the post-holiday surge. Although we did experience some minor increases after the holidays, no huge spikes were noted. We had the Christmas Eve celebration, we had the New Year's Eve celebration, we had the Traslation, which purportedly would have been a super spreader, but the expected rise did not happen. No? So the decision has been today, the decision to shift to MGCQ has been arrived at with the concurrence of the majority of the local government units of the NCR.
Well, that is true. There was a vote of 9-8. It was a slight win for the shift to MGCQ. But, Secretary, so I asked you a while ago, are we ready to shift to the more lenient MGCQ?
I think we are ready. I can say that because after 1 year, we have managed to keep our infection rate manageable. When I say manageable, it is at a level that has not overwhelmed the healthcare system. So I think the local government units have actually been increasingly effective. But of course, you know, you cannot discount the fact that you will have some spikes now that we see that's happening in Pasay, in I think even the Botas. But I think the interventions of early detection, isolation, treatment, and reintegration strategies, no, are very much in place. And I am quite confident that the LGUs are able to more effectively implement localized lockdowns. Because I think moving forward, we really have to depend more and more on effective localized or granular lockdowns. Because as the economic development cluster has been saying that if we continue on a high levels of community quarantine, then the damage to the economy might be irreversible. So we really have to balance all of these, health and livelihoods. And it's a very delicate, very difficult balancing act, no? So we just have to keep monitoring and doing what we have been doing, guiding the LGUs in improving their prevention interventions, massive interventions through the BIDA solution. You know, the usual face mask, face shield, physical distancing, and sanitation. And the use of disinfectants, etc. No? And then, of course, the early detection is the key. You don't want people to be going to the hospitals, no, as much as possible. You want to catch them early on. So surveillance, key. The early detection, massive testing, aggressive isolation, and quarantine. All of these are a key to effectively maintaining the low levels of infection rate.
So it's clear, no, Secretary Duque, that tonight the IATF will be recommending to the President a shift to MGCQ. I wanted to ask you, though, are you confident that the President will agree to the shift?
You know, that's very difficult. You know, you don't second guess the President, as the saying goes, no, Pinky. So the president also has other sources of information. It's not limited to the IATF. So we have to respect whatever the president decides tonight. No, either way, we will support it 100%.
Okay, but do you think an announcement or a decision will be made tonight by the president, whether he okays the shift to MGCQ or he doesn't?
Well, it's very difficult to make that assessment, proceeding from my earlier statement that I don't want to second guess the president. So we will just have to wait. He has the always, it is within his authority to get information beyond IATF sources. No? So he might have his other
Okay.
sources of information that will help him make the definitive decision. There will be a definitive decision, but as to when,
Yeah.
that is not something for me to say. Thank you.
Yeah. So Secretary, let's look at the cases. There has been rather an increase in cases. Even as you mentioned a while ago, there's been an increase in Pasay, Navotas, Marikina also, and even Manila. So we have about over 550,000 cases. And what's important really is to look at what's happening in NCR or Metro Manila. There's about 225,000 cases in Metro Manila. That's about more than a third of the total number of infections. So, and then let's go further. Let's look at the numbers. If you look at the numbers right now, yesterday, Sunday, 1,888 cases. Saturday, there were about over 2,000 cases. Is this not very clear to you as Secretary of the Health Department that the numbers have been rising the past couple of days or even week?
Yeah, we have to keep monitoring the numbers, Pinky. The 3-day increases is not a complete picture. The way we do it is in the IATF, our sub-technical working group on data analytics will always present a 2-week trend or pattern. Cannot be just a 1 day or 2 or
Okay.
3 day figures. No, it will not say much, but you need to be able to average this out more credibly within a 2-week period. So let's wait until next week, perhaps, or late this week. I think the data analytics will come up.
Yeah.
As I always
So
underscore, we have to be data driven. No.
absolutely. So it's good you said that, Secretary. It needs to have a 2-week period in order to be able to look at the data. So if we're looking at least the past 3 days that there have been an increase, you want to see possibly what happens this whole week and maybe a couple of days till next week. Would it be wise to kind of defer first this proposal to shift to MGCQ?
Well, we have deferred, as I have told you, many times since the start of the holiday season in December. No? And we have not seen the surge that was projected on account of the post-holiday season. And so there has been some consistency. And this is the reason I should like to believe that the economic development cluster has strongly proposed for for a de-escalation o pagbaba ng community quarantine to MGCQ. So we just have to test the system if it shifts to the MGCQ, assuming the president decides. The president decides. Then it's like a stress test for the system that is in place. If we can actually bring down the surge, it means that the system has been pretty much stable, and we really have to move towards risk mitigation rather than risk aversion. No? Risk mitigation with the goal of course, keeping the infection rate low. And when the infection rate is low, the chances for mutation are also low. No? So this is what we have been telling the local government units. There is no room for complacency. No? So they have to really double up on
Okay.
their
So,
contact tracing, etc.
Secretary, we need to talk about how the Okta research group sees a shift to MGCQ, also the WHO representative here in the Philippines. We also need to talk about this UK variant, how it is spreading, and this Philippine mutation. But we need to take a very short break. We'll talk about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Secretary Francisco Duque. Secretary, we just need to get some of the reactions. Number one, let's talk about the Okta Research Group. They're saying that if we shift to MGCQ, we can possibly see about 2,400 cases. This is going to be, they say, the same level as we experienced in August of last year when the pandemic was almost unmanageable, when the hospitals were so full and the doctors and health workers were already seeking help. Are you concerned that this can actually really happen? Ito pong nangyari nung August can happen again now if we shift to MGCQ?
Well, of course, I hope it will not happen. But you see, in July, August, our cases really rose to as high as about 6,000 plus per day. So that was really terrible. No? But now we're smarter. We know what can be or should be done. The LGUs are somehow have reached a level of mastery of agility and effectiveness in bringing down their cases in select barangays, for example. Kasi ito naman nangyayari, it's not the entire Manila, entire QC. It's really just like 20%. 80%, most of the cases come from about 20% of their barangays. So the important thing is really the 5 strategic pillars of the pandemic response. Again, I underscore, the massive, effective preventive measures, and of course, as I've said, the early detection, isolation, quarantine, treatment, and a good referral system in place. Patient navigation is in place.
Yeah.
We have the One Hospital Command Center that we have established after the August surge or spikes. Then we have the Oplan Kalinga, where we take people out, those exposed to confirmed cases, and quarantining them and isolating them. So we have now all the indicators in place.
Okay.
That in the event an impending surge is detected, then we can easily escalate. So you have to be nimble. The system has to react in such a way that it is guided by metrics. You need metrics. Parang dashboard ng kotse, no? You have the speedometer, you have the tachometer, you have the fuel gauge, you have etc. So you have to be constantly monitoring all these metrics so that it will tell you we have the gatekeeping.
Okay.
Yung tawag dyan, gatekeeping indicators or parameters. No? For example, when we de-escalate, we have to see or look at the average daily attack rate for 2 weeks, as I've said earlier. The 2-week growth rate, which measures the speed of the transmission, no? While the average daily attack rate measures the risk of infection in a given population. And then, of course, the third important metric, which guides the IATF whether to recommend an escalation to an ECQ or, in fact, ECQ, no, at the extreme, no, is really the healthcare utilization rate. So right now, Metro Manila's healthcare utilization rate is at 34%, no? Which is at a low risk. So these are objective indicators that will help us make whatever recommendations are to be forwarded to the President.
Well, I understand there are many indications that need to be looked into and examined, Secretary. What I want to find out from you is, paano po pag umabot yung kaso na 2,400? This is not in the country, but in Metro Manila, as estimated by Okta. Sabihin po natin umabot sa 2,400. Sabi nila by third week of March, I think March 26, if we shift to MGCQ. My question is, this time around, kaya ho ba ng mga ospital?
So far, tingin natin na kakayanin naman, no? So, we will never be able to know until that situation actually evolves, no? Whether the system is ready. So, we'll see. Well, the important thing is we are nimble, we are agile. We can always escalate if the data support escalation, given the metric of healthcare utilization rate, the 2-week average daily attack rate, etc. And if it does happen in one of the cities of NCR, the LGU already knows and they've been somewhat adept in doing localized lockdowns. No? So that the way to go is to really do localized lockdowns. Rather than widespread community quarantines.
Okay.
I think really the localized lockdown is good in the face of course, the progressive improvements, no? The improvements in our healthcare capacities, no? Because marami na tayong TTMFs ngayon, yung testing labs, marami na, so etc.
The other concern, of course, Secretary Duque, is vaccine first, sabi nung iba, before we ease restrictions. I want to get your thoughts on that, but we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. We have Secretary Francisco Duque. Sec, where do you stand here? Yung sinasabi po ng iba na dapat mauna muna yung vaccine bago tayo mag-ease ng restrictions.
Alam mo, Pinky, dapat dito kasi sabay-sabay hanggat sa maaari. Hindi pwedeng sequential. Ito, mauna yung bakuna, tapos susunod bukas na ekonomiya. That's not the way. It's too narrow a perspective, I feel. No? This is my personal opinion. My take on this is really simultaneous, broad front approach. No? So yung minimum public health standards, dapat tuloy-tuloy yan. You know why? Doesn't mean that just because nabakunahan ka, you will no longer have the infection or you will no longer carry the virus. In fact, there is no evidence to show that the vaccine can bar or prevent transmission. Hindi po nangangahulugan na bakunahan kayo, hindi na po kayo pwedeng tamaan ng virus. Pero of course, yung bakuna, nakakatulong yan para maiwasan yung severe COVID-19 infection. Some others, they prevent mild infection. And if it prevents severe infection, most likely, walang mamamatay. Kung meron, kakaunting-kakaunti. No? So, dapat po ito sabay-sabay natin gagawin. Yung minimum public health standards, yung ating pong PDITR, yung aking pong binanggit kanina, dapat ay nakabantay lahat yung mga pamamaraan na iyan. Hindi yung gagawin mo yung isa, kakalimutan mo na yung iba. Hindi po ganun yun. Kaya tuloy-tuloy po tayong magpapaigting ng ating minimum public health standards or other public health interventions. Isolation, quarantine facilities have always to be, capacity should be available at all times. You know, hospital bed capacity for COVID, critical, severe COVID cases should always be there, ready. No? So it is a broad front approach. Dapat malawakan ang pamamaraan, hindi mutually exclusive. Kung bakuna muna, tapos magbubukas na ekonomiya, etc. Hindi, sabay-sabay natin gawin ito.
Sabi po ni Senator Bongo, and I quote, para sa akin, personally, bakuna first. Vaccine rollout first bago natin luwagan ang ating ekonomiya. That's why I was saying, Sec Duque, iba-iba din po yung pananaw ng mga, economic managers. That's for sure. Isa po ang kanilang direksyon. Some senators are also saying, dapat talaga mauna ang bakuna, especially for our frontline healthcare workers.
Well, we respect the opinion of everyone, with respect to when do we de-escalate or when do we loosen up the restrictions to allow for more economic activity. No? But I am of the position that what we have begun must continue. Okay, all the capacities that we have built must
Okay.
be sustained, if not increased over time. Okay, and then the economy naman has actually opened up already. It's not as if it was closed for the longest time and they were opening up tomorrow. In fact, we have gradually opened up economic activities. No, we have increased economic activity, and in fact, yung GCQ nga natin, marami nagsasabi, it's really a de facto NGCQ because increase na rin yung capacity sa mga
Yes, yes.
sa mga restaurants, no? So, I think it is inaccurate to say na parang bago magbukas na ekonomiya, bakuna muna. Because in the first place, nagbukas na tayo ng ekonomiya. But not to the level that will really hasten or facilitate the level of economic activity seen prior to the pandemic. So, magbukas na tayo ng ekonomiya. Hindi naman
Secretary,
kuya para magbukas pa lang.
Secretary, opo. Sabi po ni Sec. Harry Roque, si Pangulo daw naiinip na dahil wala pang vaccine. I only have 1 minute left, Secretary. Kayo, dalawa lang tanong. Kayo ho ba naiinip na dahil wala pang vaccine? And do you have any idea, any update kailan dadating ang first batch of vaccines?
Well, hopefully, baka at the earliest, we're looking at end of the week or early next week. But again, the best person to answer this is the FDA Director General. I understand the vaccines from China are ready, but the EUA is being worked on for immediate issuance without compromising the safety, efficacy of the vaccines, of course. It is of paramount importance that the vaccines that will come or arrive are indeed safe and efficacious.
Okay. Naiinip na ho ba kayo, Secretary?
Well, alam mo, ang problema yung global supply shortage, deficit. I'll tell you, Pinky, the UN came out with a report, no? 10 countries have cornered already 75% of the vaccine supplies. Okay? That's according to the United Nations. Even WHO has said their goal of vaccinating the poor countries, people in the poor countries, have not actually begun. There are 130 countries that have not begun their jabs or their immunization against COVID-19. So yan ang talagang malaking problema natin. Number one, global shortage of the supplies, inequitable access, okay, vaccine nationalism in the first world countries that tend to corner the chunk of the vaccine supplies and almost not thinking much about the third world countries, no, access. So that's what we're doing. We're doing our level best. You know, the vaccine czar, hindi na po natutulog yan. Si FDA Director General, talagang we're doing our best to make sure that the vaccines that will come, at least hopefully early enough. But alam na nga natin ay talagang na huli because of the shortage. No? And then ngayon, maganda naman nangyayari na meron tayong kasalukuyan na immunization na gaganap sa measles, rubella, and the oral polio vaccine. You know, this is very important. Kasi that's why I would like to take this opportunity, Pinky, no, to remind the parents, punta na po kayo sa mga vaccine centers, sa ating po mga fixed sites immunization centers,
Okay.
rural health units, no, para yung mga bata hindi magkaroon ng measles outbreak or polio outbreak. Kasi can you imagine, no? Kung di natin gagawin nito, tapos darating yung bakuna, babakunahan natin against COVID, tapos may nangyayaring measles outbreak. I mean, that's going to be a very
Opo.
difficult scenario. And we're almost completing the
Okay.
supplemental immunization activity this month or until early March, no, for measles, rubella,
All
and
right.
polio.
Health Secretary Francisco Duque, sir, wish we had more time, but overtime na po tayo ngayon. Maraming salamat po sa inyong oras.
As always, Pinky, it's always nice to
Thank
be
you
back.
for joining us here on The Source.
Yes, certainly. Until
Thank
next
you,
time.
sir. I'm Pinky Webb. You're watching CNN Philippines.